saying plus or minus, it's just telling you, yes.
I just want a question regarding, so you're saying that people's homes have been in maybe fires or floods or destroyed in some way, and that they need some help in moving out of there and reestablishing their...
Not that it would help, it would have to do with when they sell, or it would have to do whatever, it would help in that. It would help move that. It's not like it's going to give them aid, it just... When you go to
does that? My basic question is, I'm assuming these people have homeowners insurance, and wouldn't that be a financial aid to them because they're not? They will have property loss.
Move on. Something different.
No question.
But
yeah,
is that just
no. Yeah. Do remember what the purview of this particular thing is having to do. When you're moving, you're taking your property, whatever you have, your property tax, moving it to another property that you bought lesser or greater value. And it's only being allowed for people over 55, disabled, and they keep, because it's already there, and they keep in the idea if you have a property that's been destroyed or contaminated. So it's not changing that, but it is expanding where that Proposition 13 tax rate goes. That's what it's all about. So who's supporting this? California Association of Realtors, National Association of Realtors. They put it on the ballot. They actually physically said they put this on the ballot because they were hoping to encourage older owners to move and open up those houses to others, because they'd be moving theoretically smaller or whatever. Just to let you know, that's what they were doing. Who's against this particular measure is educators, public safety, and healthcare groups, as well as the California Teachers Association. And I'll tell you why. Supporters say more houses will become available for younger families because of where you're moving. Older adults on fixed incomes need this protection. Protects Proposition 13 tax reductions. Opponents say, actually, though, essential local services and schools will be affected. Loss of local revenue will become worse every year. Some seniors already receive Proposition 13 sections. So this is one, truly, it's up to you and what you consider the priorities and what you would like to do with it. Proposition 6, road repair and fuel taxes. This is an initiative, constitutional amendment. Now, what is it doing? We passed in 2017 legislation called SB 1 that increased tax and other fuel taxes as well as car fees for transportation costs. This particular proposition wants to repeal SB 1, and it wants to also require voters' approval for similar taxes in the future. That's a very critical part of it, voter approval. Right now, that's not how it is done. Now, what is the current SB 1? You have to know that before you know what you're repealing. Have to remember that gas tax hasn't been raised in 15 years, and so then we just passed this increased our gas tax, the SB 1, 12 cents per gallon for gasoline and 20 cents per gallon for diesel, with a future adjustment for inflation. Now, where is this tax money? Where is it going? Where has it gone? Is state bridges and culvert, about $400 million. County road work, $200 million. State transportation, $100 million. Workforce apprenticeships, $25. Local planning grants, $25 million. And university studies of transportation as well as parks. And then there was a tax increase from boats and off-road vehicles. Now, if you repeal this, you would cut transportation tax revenues from $4.4 billion to $2 billion in 2018 and 19. After that, the transportation tax revenue will not increase for inflation, so that it will be effectively smaller each year. According to the legislative analysts, and if you I mention that is that if you really want to get into some very, very good fiscal as well as analysis, go to the legislative ad, the lao.ca.gov, and it really takes every one of these propositions and in pages will break it down and really very objective and give you some very clear, good kind of facts if you force the in-depth look at this. The new requirement that most transportation-related taxes must be approved by voters in addition to legislative will make it more difficult to fund transportation costs in the future. And that's according to legislative analysts. And its cuts will affect state highway maintenance, local streets and roads, as well as mass transit. So they're looking at fiscal effects. And there's more, but
Who's for this?
pardon?
Who's for it?
For it is the group calls, and they're paying money, repeal the gas tax, reform California, it's an anti-tax group, Drivers Taxpayers Association, U.S. Speaker of House of Paul Ryan, and they pay money. I'm only giving you those who invested money. The California Republican Party and the National Federation of Independent Businessmen. So who's against this is Bridge Safety, Business, Labor, Local Governments, Transportation Advocates, Governor Brown, Mayor Garcetti of LA, and the California Chamber of Commerce. Those are against this initiative. The last piece I'll say is, here's what supporters are saying. The supporters of the repeal. They're saying gas, taxes, and fees are too high, fall hardest on working families, and are unnecessary with a budget surplus. Some dollars of the tax increase will be diverted to non-road related projects. So supporters say for this repeal, including parks and training for formerly incarcerated felons through the Workforce Development Board. There is a small piece that talks about this. Tax increases on gasoline that directly affect people's lives are too big for the governor and the legislature to decide. That's what those who want to repeal it say. Those who oppose it say more than 1,600 bridges and overpasses are structurally unsafe. 89% of counties have poor roads. Roads with potholes and cracks are a major safety threat. Reliable roads are critical to Californians to work and move goods and services. Requiring voter, and this is why we need to keep what we have. Requiring voter approval of fuel taxes already passed by 2/3 of the legislature makes it hard to fund transportation projects. So, just to keep it clear, if you have a yes vote on this, you're going to cut the gasoline tax and dollars for road repair. If you say no to this, you'll keep current the tax rate and the dollars for road repair. Just so when you start going in the negative versus around, this is what I wanted to make sure we know what we're voting for. You'll love Proposition 7. This is all about year-round daylight saving time. Legislative statute. We'll try to do this fast. What it does is it would move toward the possibility of California having year-round daylight savings if California legislature votes 2/3 and there's a change in federal law. So my point is, I guess they're taking the pulse. It's really what this is about. Background, in 1949, you know that we did have the daylight saving time in the summer and standard time in winter. Federal law allows year-round standard time, as in Hawaii and Arizona, if a state wants it, but not year-round daylight saving time. Year-round standard means summer evenings are shorter. Year-round daylight saving, sunrise is later on winter mornings, just to refresh your memory. Why is it on the ballot? Because legislative change, it needs to hear, before they even move forward, whether voters approve of it. There's no fiscal effect at this point. Only people who are for or against happen to be legislators. It's not that they're immaterial, but it's not. It depends on who you want. Supporters say, per medical studies, heart attack risk increases during days following time change. Twice yearly change increases electricity use by 4% and fuel used by cars and costs $434 million. Opponents say U.S. already tried year-round daylight saving in 1974 due to the energy crisis. People hated getting up in the dark in the morning. I always have to laugh because it's their fact. You hated getting up dark in the morning. There are no conclusive studies that year-round daylight saving time saves energy and money. That's the other opposition. Lots of studies, but they're saying there are no conclusive studies. So enjoy whether or not you want to have year-round. This one is an interesting, and do remember about our propositions and our initiatives. You have a lot of special interests use this. You know, whether you like them or not, it is what we have. And so sometimes you're going to get something that seems, you know, is not so much obscure, but very, very pointed to what it is. This is one that's an interesting one, but you really have to be, I think, in the area. This is all about kidney dialysis charges. What it is that it wants to, this proposition requires companies that operate dialysis clinics, that means those who treat kidney failure, to pay back insurers any profits over 15% of qualifying business costs, and it would allow the courts to increase what qualifies as business costs. Why would we care? Well, to be very honest, there's only two dialysis clinics, two big businesses, for Fresenius Medical Care North America and DaVita Kidney Care, that are running the clinics for the state, and they have them all underneath it. So there are two that they're, in a sense, focusing this particular proposition on. Dialysis in California is a $3 billion per year business. Most dialysis is paid by Medicare and Medi-Cal at lower rates. Private insurers pay much higher rates. Two companies own most of California's 588 dialysis clinics, the Fresenius Medical Care and the DaVita Kidney Care. Who is for this? For this increasing how much that they're going to give back over their profits is the SEIU, Service Employees International. And the reason they are is because these particular clinics do not allow unionization of workers, so just so you know that. And then who's against this proposition? There are only two that are listed. Is the Fresenius Medical Care of North America and DaVita Kidney Care. I'm not making light of it, but it just shows you what they had to go through an initiative process to do this. Supporters say this will provide an incentive for dialysis companies to lower their costs and improve patient care. Insurance costs will go down if dialysis costs less, and it is expensive. These companies overcharge patients and resist unionization of workers. That's what those who want to, in a sense, affect their bottom line. Opponents say, well, it sets arbitrary limits on what insurance companies pay for dialysis, which won't cover all costs. Clinics will cut back or close, so patients will have less access to care. You have to remember there's only two companies running this, so, you know, they may just cut back. Fiscal impact, it depends on how the clinics respond and where allowable costs are currently set. Company profits will likely decrease. Healthcare costs will likely decrease. So that's Proposition 8. Proposition 9, someone asked me why it's removed from the ballot. Remember, that was the one that was going to divide California into 3 different states. So it went to the courts, and the California Supreme Court said this initiative was probably not constitutional and could be harmful. So it was removed from the ballot. Proposition 10, rent control. This is an initiative statute. What it does, it would repeal the 1995 state law so that cities and counties, it will allow cities and counties to expand rent control. However, landlords must still be allowed a fair state of return. Now, under the background of this, under the 1995, and you've heard of it, it's called the Costa-Hawkins law. Landlords can freely raise rents for single-family homes, apartments built since 1996, and new tenants. That's the way the current law is. Thus, cities can only limit rent increases on apartments built before 1995. The new law, cities and counties could also limit rent increases in single-family homes, apartments built since 1996, and new tenants, so it's going to expand. Yes?
Isn't there any mention of owner-occupied duplexes in Triplexes?
That's another one.
That's a separate.
That's a separate one. There's
You're
another
talking
one
about
coming.
Oakland? I'm talking about the state.
No.
Mr. Hawkins.
No, that's a different, yeah. We'll get to it. This one, who is for this rent control is AIDS Healthcare, American Federation of Government Employees, California Nurses Association, California Democratic Party, Mayor Garcetti of LA, and California Teachers Association, California SEIU. Against it is the California Rental Housing Association, the California Apartment Association, Business, Tax, and Veterans Groups, and the California Republican Party. So it's interesting, it's drawing those lines. What this is going to do is it will allow cities and local communities to decide what makes sense for their housing issues. Could protect seniors and families and others with lower fixed income. Opponents say leads to less rental property because landlords stop renting and building is discouraged. Allows creation of new local bureaucracies with power to regulate rents in all types of residential property. Because it is telling us that it will, locals can, in a sense, they will create some departments to be able to look at the whole rent control and what they're going to be doing. Impact is that it's difficult to predict because it depends on the specific rent control ordinances and on the reaction of landlords and tenants. With more rent control, landlords will have less income to pay taxes. The value of rental housing increases more slowly over time. Property values and tax revenues are lower. Overall, they said fiscally, the state and local government's tax revenue cut by 10 to 100 million per year. Losses could be less or more, they're not sure. But this is just that very specific to that rent control and changing the Costa-Hawkins law. That's what that's about. Proposition 11, ambulance employees. Initiative status, basically, this one is, it wants to allow private ambulance services, which most local jurisdictions hire or have, to require their ambulance workers to remain on call during meal and rest breaks at regular pay rate. Also provides additional training and some paid mental health services. What the background of this is, the Supreme Court ruled about 2 years ago that security guards don't have to remain on call during meal or break time. And there was a lawsuit then. A number of private ambulance firms faced a lot of class action suits in California courts over what they call break time violations, including American Medical Response. But what they do want is since they couldn't work out a solution, the company and employees about whether they should be on call or not, it went to this particular status. You have supporters say, let's retain the long-standing industry practice of paying medical personnel to be on call during breaks. It's essential that emergency personnel can respond quickly during mass casualty events, and it does require additional training to meet emergency standards if they don't already have it. And there are no arguments that have been filed against this one. It's kind of reaffirming so they can get it out of the court that this is what the standard practice is going to be. They think that it will save providers and local governments from the cost of more ambulances to cover off-duty breaks. They think there's that potentially over 100 million ambulances, so there is that issue right there. It might require providers to have more ambulances in some areas and increased cost for companies that don't yet offer the required level of training, and many do already, but they're telling us they could do it. So that one is, is up to you to say. As I say, nothing's opposed to it. They feel that it probably should go that way. Confinement of farm animals, Proposition 12. Remember Proposition 2 of 2008 that required farm animals, in particular chickens, they wanted to have the animals could stand up and turn around in their cages, and they even have specific square foot requirements and a few additional measures. However, this one is going to expand it. What it says is we want to place new requirements on the coops and cages that contain breeding pigs, veal calves, and egg-laying hens. Require all egg-laying hens to be raised in specified cage-free conditions, and it applies to related food products sold in California, even if the farms are out of state. So they're applying the same standards, whatever's coming in. The fiscal is it'll cost higher business to build new pins to decrease, and will decrease state income tax, and enforcement will cost, because they will have to do, they figure that's up to $10 million per year. Who is for this? Humane Society U.S., Humane Society Legislative Fund, and American Society for Prevention of Cruelty to Animals, and about 33 animal rights. And who's against it? It's an interesting name they have, Humane Farming Action Fund. Actually, they are the ones that always oppose animal welfare legislation. It's why you have to look up who's supporting, and their names are not necessarily indicative of who they are. What are supporters saying? It strengthens and clarifies farm anti-cruelty law, prevents egg-laying hens, breeding pigs, and veal calves from being housed inhumanely in small cages all their lives. Critical support is that it will reduce the risk of human illness from factory farming. And that is the bottom line right there. Opponents say, good cause, price increases for eggs, pork, and veal. 2020 is too soon, may lead to shortages. Court or legislative challenges from other states that don't conform, because there is that, because we're requiring it. And it's not truly a cruelty-free alternative. Well, this is true, because you're still keeping them in cages. But, just to give you an idea. All right, those are your wide variety of propositions. And I'm watching the time. And very importantly, and we're going to look at and answer your question that you were looking for duplexes and whatever we're going to look at.
That's a separate issue. I don't
For the pros and cons for local, we have the two Peralta Community College District ones, and we have East Bay Regional Parks District one. But I'm going to go first to what I call the City of Oakland measure. We first are going to start with Measure V. This is the taxation on cannabis. What is it going to do? We have to understand something. In 2009, Oakland became the first city in the country to tax medical cannabis businesses. The current city tax on medical cannabis is 5% of the gross receipts. In 2016, California voters approved Proposition 64 to legalize non-medical cannabis and impose taxes on cannabis businesses. The state imposes an excise tax of 15% on the purchase of cannabis and cannabis projects, as well as a tax on cultivators of harvested cannabis that enters the commercial market. Oakland now taxes sales of non-medical cannabis at 10% of gross receipts. Other taxes are also imposed at varying rates for commercial production. Taxes are collected annually. Cities can set their own taxes on cannabis. Those in Oakland were set by voters in Measure B of 2010. Some nearby cities have lower tax rates than Oakland. There rests the issue right there. The proposal is one to enact an ordinance to allow the city council to decrease tax rates on cannabis on their own authority without going to the voters. Cannabis businesses will be able to spread out their tax payments by paying quarterly. Cannabis producers will also be allowed to deduct the cost of raw materials, calculating their tax obligations. As far as fiscal effects, there's no estimate of effects that have been provided by the city. Supporters say Measure B will make it somewhat easier to run a cannabis business and help prevent people from engaging in illegal cannabis production and sales to avoid taxes and bureaucracy. Decreasing tax rates will make Oakland more competitive in the cannabis marketplace and reduce incentives for buyers to go to other cities. There are no arguments against cannabis, so it's purely up to you. But I think the critical thing is that it wants to be an ordinance is to allow the city council to decrease it on their own without coming to the voters. That's probably what you'll make your decision on.